viewers. Today we will do the regular, give the update on what's happening over the last 24 hours in terms of results and other basic or important statistic. And then in our COVID conversation, of course, we want to look at the most recent protocols that have been announced, particularly as it relates to persons coming into the island, a further relaxation of measures in some sense, meaning more persons coming in, and specifically around testing, which is one approach to screening, but we think requires some explanation, discussion, and we will get a perspective from the Consul General, but also from two Jamaicans who have gone through the process, and then of course get your feedback around issues, questions, comments. So if this is the Thursday, June 2nd, 2020, and the current case numbers are as follows. 8 new samples have tested positive for COVID-19. That's 8 new samples in the last 24 hours. Total number of confirmed COVID-19 cases in Jamaica is now 715. The new cases are imported, having arrived recently on flights from North America, from the USA. There are 4 males, 4 females, ranging in ages from 21 to 2 are non-Jamaicans who are staying in Five more patients have recovered from COVID-19 and released from isolation, bringing the total number of recoveries to 560, which in percentage terms means a 78.3% of recovery based on the numbers of positive cases we've had. So that's 78.3%. Of course, the issue here is that we are seeing a fair bit of recovery, which is a positive thing, and that clearly is something that we need to recognize and celebrate our healthcare workers who have provided critical assistance in this regard. In terms of patients repatriated to country of origin, of the number, 9 so far, that's 1.3%. Active cases, there are 136 or 19% active cases currently under observation, and we have 1 moderately ill patient. One of the things that we're quite happy about is that we have had fairly low numbers in terms of moderate or critical illnesses are associated with the virus. We have no critically ill patient now. We have 1 moderately ill, and that again helps our numbers in terms of fatalities or deaths. We have had 10 to date, and while we regret those 10 in the overall scheme of things, it hasn't been that bad. In terms of classification, the 715 cases are classified as 200 imported cases, 233 cases that are contacts of confirmed cases, 39 local transmission cases not epidemiologically linked, 236 related to the workplace cluster in St. Catherine, and 7 under investigation. So that's the classification of the 715 cases. Gender classification, 57% or 405. Cases are females and the rest males, of course, 310 or 43%. The ages of all confirmed cases range from 2 months to 87 years. So far, we have done some 25,229 samples that have actually been tested with 24,457 being negative and 57 are pending. So we've done over 25,000 samples. In the last 24 hours, we've done 278 new samples. Were actually tested in the last 24 hours. There are 137 patients still in isolation. So patients that are separated from the general populace because they are essentially being observed and treated into recovery. 137. 12 persons of interest are in quarantine at government facilities. While some 4,554 are in home quarantine. So quite a number of persons are in home quarantine, which has been a significant shift in the policy approach. And that is so because of the numbers that are now coming in as part of the gradual opening up. The arrangements to inform, educate, and require these persons to stay at home and one of the things that represents a challenge for us, which we have to keep repeating, encouraging, is that persons who are in home quarantine arrangements must observe the protocols, the orders that are given that accompany home quarantining. Otherwise, if you are positive, you run the risk of not only creating harm to yourself, but to your family members and, of course, your communities. And we've seen a few cases of that. For the most part, clearly, we are satisfied that persons are observing, but it only takes one or two to create major mayhem because of the spread. So a large number, 4,554, are in home quarantine. It is now more important than ever, as we have said, that Jamaicans remain vigilant in their infection prevention and control measures to reduce the risk of exposure to COVID-19. Jamaicans must take on the personal responsibility to protect themselves, their loved ones, their communities, and country. We would like to reiterate that the outbreak or COVID-19 is not it's not over, and it does not become milder than it was when persons were fearful or more fearful of the virus. You only need to look across the borders in some other jurisdictions, and you will see the extent to which COVID continues to be a major issue, influencing hospitalization and even death. We have been fairly lucky here because of some of the measures, because persons have been compliant, but there is a sense now that persons are becoming lax in their approach, maybe because of the successes we have had. We want to, from public health, emphasize that we still have a risk, a going concern, a clear and present danger, and it's requiring of all of us to play our role in managing the process, taking on personal responsibility, and working with each other, because as we like to say, everyone counts in this fight against COVID-19. So the outbreak is not over to all Jamaicans. Let's play our part. Maintain a physical distance. We've said 6 feet from each other. Staying at home where you can, and in relation to the stay-at-home orders, observing the protocols around isolating yourself or quarantining yourself, avoiding crowds, still emphasizing that once you can. If you can't, of course, wearing masks when physical distancing is not possible, such as in crowded situations. Frequently washing and sanitizing hands and cleaning of surfaces where droplets may fall. And of course, obeying quarantining and isolation orders as given by the public health authorities. We all, again, have a role to play. We all must play our role as we move into the phase of greater opening up, more persons being allowed to come in, relaxation of more activities internally within the country, as announced by the Honourable Prime Minister and others, Minister Mackenzie, Minister Bartlett, and others. It is so important that we remain vigilant and we observe these protocols, because otherwise it only requires one weak link to create a further challenge as it relates to the spread of the virus. Okay. No? Okay. All right. So we're going to stop here as it relates to the announcement of the numbers. And I believe we will go now into a discussion around the new testing protocols, because I think that's where a lot of questions have been posed to public health and generally. And it's important for us to get the country to appreciate, to understand what this means. So the Chief Medical Officer will now go into a presentation. It will be up on your screen as it relates to this protocol that was signed off on by the Cabinet and announced by the Prime Minister, after which we will have a discussion. CMO, have your mic on?
Thank you, Minister, and good evening to everyone. Just a few notes before we look at the protocol. So from June the 1st to the 30th of June, we had increased the number of persons that were arriving in the country. And June 1 to June 14th, Jamaica opened its borders to Jamaican nationals that were entering the country through our airports. On June the 15th, visitors were allowed to land, and this included 3 categories of persons that were traveling with a non-Jamaican passport. These are persons with Jamaican ties who were visiting friends or relatives who would not be staying in approved facilities in the tourism corridor, persons who were visiting Jamaica for business purposes, and persons who were traveling as tourists and were staying in approved hotels in the tourism corridor. During that period of time, we had mandatory PCR testing done at the airport for all travelers, and the travelers for tourism were tested at the airport, and they were quarantined at their hotels until the results were available. And if tested negative, they would have stayed in the tourism zone, and the positive cases arrangements would have been made for isolation. For Jamaicans and non-Jamaicans outside of the tourism corridor, these persons were also tested and a quarantine order was served for 14 days. Positive cases were isolated and the isolation could have taken place in their homes, or if the homes were not suitable, then they were put in state facilities. Business travelers were tested at the airport and they were quarantined in the hotel until results were available, and if positive, they were to be isolated.
It's not on the screen though.
No, I'm not there. So during this period of time, we saw from the 1st of June to the 30th of June, we saw over 12,000 persons coming into the country, an average of 5 flights, 410 passengers per day. And out of that number of persons, we had 82 persons that were positive, which was a 0.7% positive rate. There were a bit of challenges that we encountered during that period of time, in that we had to have large deployment of staff to the airport, and a large amount of resources were spent in testing. As we looked to July, we were anticipating, with the increased opening up of the borders, that there were in excess of 700 flights that were scheduled to come in with over 50,000 passengers. Based on the demand that we would have expected at the airports, we recognized that it was not possible for the health staff to be able to manage to do all of that testing. However, we fully understand that a process of screening needed to continue, and so we had to look carefully at what was the process that we needed to put in as of July 1 to have some screening of persons coming in, so that we could continue to safeguard our country against an increasing number of cases. So on the screen, you see the first slide that is now looking at the controlled entry of persons during the period July 1 to 31st. So first of all, a registration and approval is required, and residents of Jamaica are required to register on the Jam COVID site. Non-residents are to register on the Visit Jamaica site. And a travel authorization evidencing that registration and approval will be required for passengers to check in when they are to board their flights. Upon arrival in Jamaica, all persons will be subject to a health screening and a risk assessment by the Jamaican health authorities. The government of Jamaica has modified its risk-based protocols that will determine testing and quarantine requirements for arriving persons. In terms of pre-testing, we have looked at pre-testing, and you have seen in the public space that pre-testing is back on the table for us to have this as a screening measure for persons that are non-nationals that are coming into the country, especially from areas that we have seen an increase in the number of cases recently. So who will be pre-tested? Non-residents, excepting for business travelers visiting Jamaica, aged 12 and over, who are residents of locations designated as high risk, will be required to obtain a COVID-19 PCR test within 10 days prior to their intended date of travel to Jamaica. Now, please note that this list of high-risk locations is subject to ongoing reassessment and could therefore change. And as we see daily, we are seeing changes that are occurring on the global landscape, and we will change these high-risk locations as needed. Now, so where are these locations that are presently designated as high risk? So the locations currently designated as high risk for this purpose are the states in the United States of Arizona, Florida, New York, and Texas. And how will we get the pre-test? All persons applying to enter or visit Jamaica on or after July the 7th from these designated areas will be required to upload their COVID-19 PCR test certificate as part of the application process. And when is this required? This requirement will become mandatory for persons arriving in Jamaica on or after July the 10th.
10th, okay, the 7th. You said 7th before.
The application is from July the 7th.
No, it's the 10th.
Okay. Next slide, Stephen. Okay. So this is the process for residents, that is Jamaican nationals and non-nationals who are ordinarily resident in Jamaica. So for these persons, they will not be required to do a pre-test. However, on arrival, a health assessment will be done, and subject to answering of some questions, they will be designated as high risk. Now, this has to do with age, the presence of comorbid illnesses, and the level of exposure that we see in these persons. For example, if they're healthcare workers, if they're coming from institutions that you may have had COVID cases, if it is that they have been in contact with somebody who has been COVID positive, then they would be designated as high risk. Now, anybody, of course, that is coming in that has symptoms will be isolated and tested. But for the persons who are without symptoms, if they are designated as high risk, then a test will need to be done. And for these persons, we're not going to be seeing the testing at the airports. These persons will be asked to make an appointment on the JAM COVID site to have the test done in their parishes through their health departments. If the persons are designated as low risk, that is, they have none of these high risk features, then they can go home. They don't have to do a test. However, all of these persons will receive a quarantine order. They will be required to stay at home for the next 14 days, whether or not they have done a test. And during this period of time, it is very, very important that if they should develop any kind of symptoms, such as fever or respiratory symptoms, then they are to contact the health department. For those persons that have been tested, if the test comes back positive, then they will be required to be isolated. And for the persons that come back negative, they are going to continue in quarantine to complete the 14 days. Next slide. For non-residents that are Jamaicans who are visiting Jamaica for tourism purposes and staying within the resilient corridor on the north coast, the pre-testing requirement above is applicable to persons in this category if they are residents of a location designated as high risk by the Jamaican health authorities. So anybody that is coming from any of those places that we have designated, we would have expected them to come in with the pre-test done, and we would have been able to look on the website, and they would have gotten an authorization only if they would have had a negative test. However, them coming with a negative test do not escape the health assessment. They still have to be assessed. And this is because we know that persons can have a negative test a few days ago, and then they can become positive. Persons may be in an incubation period, and so even while they have been infected with the virus, they are not yet showing a positive test. And so persons who come in who would be screened and designated as high risk would still need to have a test done. And again, if any of these persons have symptoms, they will be isolated. Now, for those persons who will have a test done, they would remain in their hotel until they get the test result. And if that test result is positive, then arrangements will have to be made for isolation. If the test is negative, then it is that they are allowed to stay in property in the resilient corridor to enjoy the hotel and its amenities for the time of their visit. For non-residents who are visiting Jamaica for business purposes, these persons again will come to the airport, they are not required to do a pre-test. These persons, if they come to the airport, they will also have a health assessment done, because if it is that they are symptomatic, then these persons are going to have to be asked to go into isolation. However, they will all be required to be tested. So all business persons will have a test done, and they will wait in their hotels for the test result. And once the test result is back, if it is positive, they may need to be isolated in the hotel, but whatever arrangements that are made, those will be made at that time. And a negative test, they will be able to carry out their businesses. Next. For non-residents that are visiting Jamaica for purposes, other purposes including tourists not staying within the resilient corridor, the pre-testing requirement described above is applicable to persons in this category if they are residents of locations that are designated as high risk. So these persons that are coming in are not staying in a hotel, they're probably staying with relatives, or they're staying in some other facility outside of the resilient corridor. If they have come from any of the high-risk locations, they have to do a pre-test. But when they come in, they are going to be subject to the health assessment as well. And if it is on the health assessment that they have any symptoms, they will be isolated. If they have any of the high-risk criteria, then they will be designated as high risk and a test would need to be done. If the test is positive, they would be isolated. If it is negative, and while it is that they are waiting for the test result, these persons as well will be served with a 14-day quarantine order. So these persons will still have to remain in home for 2 weeks during what could be an incubation period while we observe if they develop any symptoms. So essentially, those are the 4 categories of persons that are coming into the country. We can stop here.
That's it?
We had the definitions. I don't know. You want to go into it?
Yeah.
Okay, next slide then. All right, we just wanted to spend a few minutes looking at some of the definitions of some of the terms that persons would have heard when they hear the orders being spoken about. So the stay at home for returning residents. Under this measure, persons are required to remain at home and allowed to leave only once per day to carry out their basic needs, food, medicine, or visiting the doctor, physical exercise, financial transactions. If they leave home, the protocols for the persons in a public space, such as wearing a mask, physical distancing, and not gathering in groups exceeding 20 persons will apply. The stay-in zone applies to the tourists, the visitors who are staying in the COVID-19 resilient corridor, which is designated for tourism purposes. Under this measure, the persons are required to remain within the hotel property in the corridor for the duration of their stay. The stay at intended address for business travelers. Under this measure, short-term business travelers are required to remain at their intended address. That is the address that they write on the forms when they're coming in, whether it is a hotel or a private home, and they're allowed to leave to conduct their businesses when their test comes back negative. Next. So the difference, just again to reiterate the difference that we have had between quarantine and isolation. Quarantine is intended to restrict the movement for persons and may be at home, in a hotel, or in a government facility as determined by the health authorities. Persons under quarantine cannot leave their quarantine location except with permission from the health authorities. Isolation is intended to separate persons who have tested positive for COVID-19 or are suspected to be positive from other persons. And this may occur at home, in a government facility, in an approved area that has been examined by the health authorities. Monitoring during quarantine or isolation. Persons who are quarantined or placed in isolation at their home, hotel, or other address will be monitored electronically and by the health authorities to ensure that they do not leave their designated quarantine or isolation location. Thank you.
Thank you very much, CMO. Ladies and gentlemen, I really have to stress, I've been monitoring myself and my team members, the comments on social media. We've gotten sort of anecdotal comments from the messenger around the views around COVID, how serious it is, whether it is happening or not happening. I cannot stress enough. I mean, too many of us feel that COVID not keep, and COVID a keep. And I want to make that very clear. We must observe the protocols that have been established. We review them periodically. If you go out in the crowds, wear your mask, practice social distancing or physical distancing as the case may be, sanitize yourself periodically to ensure that you protect yourself, because let me put it very frank in plain English, COVID a keep. And that is why everyone has a role to play. Everyone counts. And, that's my take on what the CMO has said in terms of the new measures, but also in terms of the daily updates and the risks that are going to be identified with the new measures that we are taking. No matter how we assess the risks that are clearly there by opening up, by allowing freer movement, we will not be able, as a public health team, a public health infrastructure, to capture all cases of COVID-19. Very clear. We can't. It's not possible. It should not be expected unless all of us play our part. And so if you're feeling sick because you came in from New York, Florida, or wherever over the past week, and you're at home quarantining, please call your 8881 Love number, call your health department or your hospital or your doctor. Don't keep it to yourself and pretend as if it's not happening. Again, I say, COVID a keep. COVID is here, and it represents a clear threat, and we must follow the procedures to ensure that we deal with the challenges that are there. And I can't read your handwriting, so I won't bother try it. The CMO wants to just add a few. Maybe I've stirred up a sort of emotion in her. She wants to add a few little points. But let me just say it again. COVID a keep. So Jamaicans, understand that. All right? CMO.
Right. I just want to reiterate that at this point, this juncture in our monitoring of COVID-19 in the country, we are moving away from testing everyone that is coming in. And we're moving to a situation that we're testing persons that are deemed to be at high risk. But it's not there are a lot of persons who are not going to be tested, and it's not that there is no risk, because everyone that has come from a country where there is transmission of COVID-19 presents a risk. Testing is a one-off measure, and you can only know what is happening to a person now. What is really, really important is the monitoring of the 14 days that could be an incubation period for this disease. At any time during that 14 days, even if you've had a negative test, or if you've had a test and is waiting on a result, at any time you can develop symptoms. We have seen in the past few days, weeks, where we've had persons who have come in, have had a test, and have developed symptoms within the 24, 48-hour period and have not reported it. And during that period of time, when they should have been in quarantine, would have infected other members of their household. At any point in time that you develop symptoms, you are asked to report it if you are going to protect your family members, In those households where persons have become infected, we have had elderly persons and persons with chronic diseases that if they become ill, then they can have poor outcomes. The important thing is the monitoring during this 14-day period. It's not a positive or a negative test, and especially it's not a negative test at this time, because a negative test, a person can become positive a day, 2 days later. You must monitor yourself, and everybody in the family must monitor the person who has returned. People in the community must monitor persons that they know have returned from travels. Persons in the business place must monitor if they know that somebody has come into country and is there in their office. They have a duty to say to the person, you need to stay home. Persons have a duty to stay home. And you also have a duty to report it, because it is an offense. If you have been issued a quarantine order, then it is an offense to break that quarantine order and to come out of your quarantine area. So everybody has a duty to report. If we are going to keep Jamaica safe from COVID-19, keep the number of cases below the numbers that our health system can manage, then every single soul has a responsibility to report as soon as somebody becomes sick and to ensure that all the persons that are returning from travel stay at home for the designated period.
Thank you very much, CMO. I think you've reinforced my parochial cliche, COVID a keep. And I hope that we all take that as serious business. No joke, no ands, no ifs, no buts about it. Play your part, please. CG, David, Oliver Mayer, Oliver, in the Florida COVID a keep hotspot. We've seen the news coming out of Florida. You're in Miami, of course, but you have a responsibility as the Jamaican representative there. We have so many Jamaicans and non-Jamaicans who are very much in touch with Jamaica and who go back and forth. First of all, how are you keeping? Are you COVID-free? You did a test?
Well, first of all, I'm having my good Jamaican ginger tea, because one of the most important things we can do is to ensure that our immune system is intact as we continue to learn about COVID-19. So I want to encourage everybody, if there's one thing you must do, COVID a keep, make sure you keep your immune system intact.
Sounds like a plan.
We are at the consulate, we're responsible for 13 states. Florida, Georgia, Texas, Louisiana, Arizona, North and South Carolina, New Mexico, Arkansas, Mississippi, Alabama, Oklahoma, Tennessee, as well as Cayman and Bahamas. And I just want to say that the feedback from the community, Minister, has been generally very good. People appreciate the measures that have been taken to contain COVID in Jamaica. And I think perhaps here, the economy perhaps opened up a little too fast. And in Florida, we have over 169,000 cases with over 3,500 deaths. And in one of the counties, similar size of Jamaica, similar population, Dade County, 2.7 million, they have had over 40,000 cases. Just to put this in perspective based on population. So while we're encouraged by it, we still have to continue to take the relevant measures.
I really appreciate that context, Oliver, CG, Mayor. First of all, the fact that you are responsible for so many states, a few of which have been listed by us here based on the assessment as high risk and therefore requiring testing. But I'm particularly pleased you mentioned the contextual comparison of the Dade County, where I know a lot of Jamaicans reside. I've been there umpteen times. We know that many of our people are there. And for a 2.7 million population with 40,000 cases, you didn't say the deaths, but I'm sure there'll be quite a few deaths.
1,100 deaths.
1,100 deaths compared to a Jamaica, 2.7 million, the same, with just over 700 cases and 10 deaths. It really places into perspective the challenges of both jurisdictions, but also some of the measures and hopefully some of the things that we're doing. So we hope that Jamaicans appreciate, and you are reassuring us that on your side they do. Listen, the new testing protocols that we have instituted would require persons coming from, say, Florida, which we have designated a high-risk location, and you have helped us to understand why, requires pre-testing, and in the case of non-nationals. And of course, for Jamaicans coming in, they are going to be quarantined with a date for test based on that risk assessment. Tell us a little about pre-testing or testing in Florida.
First of all, I want to say a big thank you to all our elected officials, Jamaican elected officials, closely with us over the period where we took care of all of us. Trying alone, we have just in South Florida alone, there are 32 testing sites, and that's free of cost. However, the lines are very long, and persons are waiting over 7 days to get their results. Persons can also go to private institutions. I mean, there's a fee for that, and have their results in 2 to 3 days. But once you're going to any of the free testing sites, you're looking at a wait of about 7 to 8. A lot of these are walk-ins, I mean, are drive-ins.
Okay.
See the long lines you see. So all in these high-risk states, more persons have been demanding testing, current testing, and this has been driving up.
But I want to ask you another question quickly. Our Jamaicans in Florida, how do you communicate with them to help us here in Jamaica to appreciate what we're doing, why we're doing it, and also the procedures that they would need to follow? I mean, do you find any difficulties, any concerns that are worthy of note that we should be looking at or we could help you with?
Okay, we have similar town hall meetings using the technologies. You know, to the leaders who are in education, getting out. Are you hearing me?
Go ahead, we're hearing. Go ahead.
Okay. Yeah, so we do a lot of digital town halls, a lot of the events. I mean, typically we would have had about 8 regular events per week here in South Florida have converted to Zoom type events, so we're able to update the community. Many persons watch the daily live from the Prime Minister and from you, Minister Tufton. So people have they look forward to this daily update, and they call with any questions that they may have. Some of the challenges that we have had, of course, you know, our people have been thrown in the deep end. Some of our older folks who are not as technologically advanced as others have had to learn or ask their grandchildren to help them on the Jam COVID site or the Visit Jamaica site. That has been one challenge, but you know, we're making progress with that. They call us and we support them through that process. But you know, just the whole aspect of not being able to, you know, fly down to Jamaica to spend a couple days, 3 days, 4 days. There are the withdrawal symptoms. People just want to go home, but they appreciate that safety is paramount and safety is key. And the feedback has been good at the airport. People appreciate the discipline, and they want to ensure that those who are entitled to become Jamaican citizens, they're calling. They want to get this done urgently. And Jamaica National has reported that they have a record number of persons calling in to find out if they can buy property in Jamaica. So Miss Lou had a thing, colonization in reverse. we're almost having a visarization in reverse. A lot of people want to come back to Jamaica quickly because they feel safer in Jamaica. They want to be home. And this is the sort of feedback sometimes when we get the calls, we get the frustration because people just want to go back home to Jamaica. We have people who had good job opportunities in the hotel industry, and they said, no, I don't want to go further north to take up a job because I'm worried. So I prefer to go back to Jamaica and wait until things blow off. So right across the board, there's a feeling of safety in Jamaica, but again, we're a global community, so wherever we are in the world, we all have to realize that we each have a part to play in ensuring that we maintain our individual safety and play our part in advancing the welfare of the whole human race. We all have a role to play in that regard.
Well, CG, well said. I couldn't have said it any better. I really thank you for coming on. It's quite amazing, this moment in history where the flow of interest for residency, for opportunities, seems to be in reverse, shifting, as you say, colonization in reverse. You call it visarization in reverse. I've never heard of that word, but I know exactly what you're referring to. And, it speaks a lot about our own the quality of our local systems, quality of our local people, our public health people, the coordination by the government with other stakeholders. And it may be a crisis from a public health standpoint, but it's certainly a moment to be proud of as a Jamaican. And as I like to say, everyone counts, and as long as we play our part, Jamaica actually will be relatives and friends to stay put, keep in touch, keep informed, and just work with us to follow through on the procedures. We want you to come back, let me say to you, my brother. Good luck to you and your staff. Cheers. Okay, very good and interesting discussion there with the CG. And we now have online for a quick discussion, and I know we have our media partners and others who have questions to field. Give us another 10 minutes or so, because we felt it was important in discussing the new testing protocols and new arrangements generally. We speak to persons who have actually returned recently and who have had to go through that process. So we have two persons online. One or two? One person, okay. And we're calling the person Returnee A, unless they want to say who they are. It's up to them. Returning A, good evening to you. Not hearing. Volume, please. Are you hearing now? Yes, how are you?
I can hear you.
How are you?
I'm doing well, thank you.
Great. Tell us a little, first of all, where you came from, where you traveled from to Jamaica, how long ago you came in, and how was the experience, and what are you up to now? Let us hear if you're breaching the protocol or not. No, that was a joke. Where are you coming from, and when did you arrive?
Okay. So I actually don't mind sharing who I am. My name is Lisa A. Shakespeare, and I flew in last week, Tuesday, June 23rd, from Miami, Florida.
Okay.
And I am quite happy to be back home, especially watching the news and seeing what's going on in the U.S. and especially in Florida. So I am happy to be home. And to be quite frank, I was really impressed with the COVID process because it was efficient, it was smooth, and the process was just seamless. So from the minute we landed on the airplane, a Ministry of Health official came on board and explained the entire process of what we were to expect once we left the plane. So to give you guys a rundown, as soon as we deplaned, we walked towards an area where they sanitized our hands. That was the first step. And then we went towards another section where we saw all the officers and the nurses and the doctors, and they were dressed in their hazmat suits. Everybody was wearing the suits and had their masks and gloves and stuff. And there were sections of that area that had the different social distancing signs. So they told us where to stand. So we were 6 feet apart from everyone. And there they handed us a form that we had to fill out at every section along the way, where they asked us questions, whether how we were feeling, symptoms wise, where we're coming from. Um, and it was very thorough. They pretty much asked us all the questions that needed to be asked, and we were given a form that we had to fill out, telling them where we were staying in the island. And then from there, we were instructed to go towards like a tent where the COVID testing was taking place. And I found it really funny because walking towards the area where I was going to get tested, the person that left, before I could even reach to the seat where the nurse was, another person was wiping it down, spraying it, hand sanitizer, like everything before I could get towards it. So they really made sure that there was no kind of contact and that it was well sanitized before another patient could go. So I found that really comforting. And then we did the test, which wasn't really my most favorite thing in the world. Nobody likes the test, but the test was done. They did a nose swab and a throat swab. And along the way, every single step along the way, someone explained exactly what was happening. You were not confused. And even the wait time, I was impressed by, because from the minute I landed till the minute I got out of the airport took exactly probably 1 hour. And I don't know if it's because maybe we were the only plane that landed, but just in general, that never happens. So to have the whole process taking place, it was quite seamless. And then from the testing, we went to immigration, and they asked us questions again, where we're coming from, just regular immigration questions. They didn't really ask too many COVID questions there. So after you...
Is it that we lost her?
Am I still on?
Yes, I'm hearing you. Go ahead.
Oh, okay. I thought I lost signal. So from there, once you clear immigration, before you can go to collect your bags, there's another area that's sectioned off, that's where you do the Jam COVID app. And someone explains what the app is for, how it works, helps you to download it on your...
Okay, I think we've lost the signal. Can you check to see if she's still on? No? One of the things I'd like to, well, first of all, I want to thank her for, is she still on? The call dropped, okay. We want to thank her for her contribution. I wanted to hear about the home quarantining. So if you can get her back, that's so important. What is clear is that she was satisfied with the experience at the airport. And it raises the issue of the protocols that we have had in place. And some would argue, she's back on. Okay, hello.
Yes.
Right. Can you? Well, I think we are comfortable, or certainly happy to hear of your experience at the airport. What about the quarantining or the stay at home? How have you found that? Because you would have certainly been required, like everybody else, to do that. How did you find? How are you finding that? I think you're still on that, aren't you?
Yes. Today is, I believe, day 9 for me in quarantine, and I have been home. I have not left my house, not even to go down the street, nothing. I've been home, and I'm happy to be home because I've been stuck abroad for about 3 months. So being here and with my mom, it's a good feeling. So I'm in no rush to go anywhere at all. And every day I check in on the app at least twice a day. And I love that the app sends me a reminder, hey, it's time to check in. Right. If I forget, it tells me. And I get a call as well from the Clarendon officials, like to check my temperature. I give them a temperature check. And I got a visit about 3 days after landing from 2 officials from also the Ministry of Health, or I guess the Clarendon department, wherever. Well, they came to the house and checked up on me.
Well, I tell you, I just want the listeners to know that you were not prompted in any way to give this account of your situation. It's an amazing testimony, if you will, of the system. And certainly the public health team, again, the fact that they do check up, this is something we require of them. But I must tell you, sometimes it's overwhelming given the sheer numbers, and it is getting that way. But I'm happy that you are pleased and that you are compliant with the requirements, because that is so important. Clearly, you appreciate the process. One final thing I wanted to ask, you're in the house with someone else, and part of the home quarantining or stay at home is, of course, to avoid too much contact. And I've found that some persons are tempted not to, especially if you haven't seen your loved one for a long time. How have you coped with that? I mean, I'm sure you want to hug mommy now and then, or whomever else.
I'm laughing because I actually recorded her reaction because I just know my mom so well. So I was home. My dad picked me up from the airport, and I came home before her. So when she walked in, I had my camera out and I ran to like pretend like I was going to hug her because I knew I wasn't going to. And she was like, "No, where are you going? Go away with your COVID self." And I'm like, "Mommy, what?" So my mom would not hug me. And she still hasn't hugged me, and I'm mostly in my room because I have my own room and I have my own bathroom. And I've been eating from disposable plates and utensils, and just staying to myself as much as possible. I mean, I do talk to her. She comes, stays her distance, and we have conversations. But it's
Okay.
not like normal.
Thank you very much. And I know it's difficult for Jamaicans who are very touchy-feely, and especially with our loved ones. But you sound like you have been the perfect returnee. And we appreciate that, and we appreciate the story, and hope that other Jamaicans will learn from this experience. Thank you very much. All the best.
Man.
You have a few days to go. I'm
Yes.
sure you have a lot planned. But remember, with COVID still a keep. So even after the quarantine, you continue to observe the physical distancing, the mask, and other things. Thank you, though. Good luck to you.
Absolutely. Thank you for having me.
All the best.
Take care. All right. Bye-bye.
Okay, so that's one person. Now, one of the things, CMO, while we get the other person online that I'd like to comment on, is that this is a typical experience leading up to the end of June, when, as you said, we had to deal with 14,000 approximately. July is slated to have multiples of that number. And the challenge with that kind of structure and arrangement is that you have to deal now with numbers that makes it rather difficult, hence the changing of the protocol. So I wondered if you could comment on that, just to explain to the public why the adjustment and why a greater burden is now being placed on them to go home, to wait, to go test, to go back home, and to follow that protocol.
Yes, thank you, Minister. And I want to thank the returning resident for her excellent keeping of the protocols. As we go into July, there are going to be some changes just because of the sheer volumes that we have to deal with. And you may not be so fortunate to move through the system so seamlessly at the airport. There will be longer lines for persons waiting, and we ask persons to be patient. We are trying to process persons as quickly as we can and to get persons to their homes. One of the changes that you will see is that you will not be tested at the airport, and you will go home and you will go on the Jam COVID app and you will make an appointment for testing. This is for our returning Jamaicans. So we're asking you to ensure that you do that. When you go home, make an appointment. If you are not able to use your phone, you can call the health department to set that appointment for testing. And we want you to try to do that testing within 24 to 48 hours of your coming back to Jamaica. Now, the results may not come around in such a short time, as the turnaround time is not as short as when we started, again because of the volumes of persons that we're dealing with. But what is important is that you stay at home and adhere to all the protocols, just like this young lady did, because a positive test or a negative test, you have to protect your family and you have to keep to yourself. There's going to be some changes as well in terms of the home monitoring, because we are moving to use an app for home monitoring. Right now, we're using the app for the geofencing, where they get the calls to ensure that they're in the right location. But right now, you will get calls from the health department to check on your temperature and if you're having any symptoms, and persons from the health department will visit. But as we go into hundreds and hundreds of persons that are coming into the parish, it's not going to be so easy. But there will be a new way to do this, in that you will be required to put in your temperature and your symptoms on the app, and the health department will be able to monitor you from this. Now, we are working on this feverishly, and we are hoping that by next week, the latest, that we will have this ready, so that all these persons that are coming in will be able to use the app. So for persons that are home, if you have elderly persons that are coming, then you make sure that they stay in their room, but you also try to help them, guide them, talk them through the process of how it is that they use the phone to report the symptoms. For persons that are by themselves at home, we ask the community members to support them, not to stigmatize them, but to support them in terms of helping them with whatever they need to be helped with, such as getting their groceries and other things like that. A lot of what is going to happen from now on depends on you. The health ministry has really had a lot of one-to-one in testing, one-to-one in monitoring over the last couple of weeks. Just because of the volumes, we're not going to be able to have so much of a one-to-one, which we would love to, but because of so many persons coming to Jamaica, we're unable to do. So it's going to be dependent on everybody to do their part to ensure that they stay at home, they do their monitoring, they do their reporting as they are required, and they follow the instructions. And we just ask for this period of time for a bit of patience with the process in the airport, because we know that there are some delays presently.
Thank you very much, CMO. I think you have said it all. Everyone counts. Everyone has to play a part, and COVID's still a keep. So let us make sure we play the role of being cautious and follow the protocols. Returnee B, we have on the line another individual, a gentleman I understand, who has come in recent times. Good evening to you. Can you tell us, if you want, your name? Otherwise, when you came in, what airport, what was the experience like?
I'm proud to tell my name, and I'm proud to tell my experience. So it's something that is of great joy. My name is Garfield Evans. I came in on Tuesday at the Norman Manley International Airport, and it was like I was treated like a king. The process was in straight order. The persons who serve on the first front, as it were, the elite workers, they were strict, but they were polite. They treat us with a lot of respect and understanding, and it's from their initial stage, it put inside of us to follow the protocol. I did it, and I've watched many people did it before me. But what was amazing to me was to see when I reached at a point, my docket was taken by a doctor. And our doctor I was introduced to. And behind me were two more doctors. That is more than a first world treatment. I felt so proud to be a true Jamaican for the first time in a long, long while. And I think this process that I've gone through, it was a little bit more than the normal process I would go through if there was not this case. But believe me, it's worth it, and I would never change this process to test on my own if I don't have a kit. I love to know that at the initial stage, I get an answer, I can go home, I can follow the protocol, and I can protect myself and protect others. I think this is the way forward. It works.
Thank you very much. Is there anything at all that you would change, just in case you observe something at the airports that maybe could improve the process? Anything?
No. But what I would say is, I would beg those who are coming, like myself and others, please realize that what we are really getting is really a world-class standard for simple, common Jamaican people. And it's free.
Well, you know, the response sometimes when you watch the issues, the activities around COVID in other jurisdictions, some far more resourced than we are, certainly, it makes you feel that way. You are sort of providing real-time, real-life information, having come in from one jurisdiction
Thank you.
and are now here. So we, you know, in a sense, I hope you don't mind the phrase, it's coming from the horse's mouth sort of thing. So we appreciate that kind of commentary. Now, tell me, one of the threats that we see in public health is the extent to which Jamaicans, having gone through the airport process, gone home and under the quarantine or stay-at-home arrangements, they breach that voluntarily or involuntarily by interacting with others, family members, friends, the next door neighbor, the little bar down the street, or the church up the road. And the consequences, we have seen at least 2 cases where the consequences have been a spread, which required significant intervention. And we are very keen on trying to get Jamaicans to appreciate their role. How has been your experience having gone home? And then secondly, what else, if anything, could we do in public health to get Jamaicans to appreciate the importance of playing their part in that regard?
I want to answer you. With what you have done for me, I'm talking for myself, at the beginning of the stage, knowing the seriousness of this disease, or virus, it led me with appreciation to come home and follow the principles, in spite of the fact that my wife is a doctor in pharmacy. That doesn't matter it. What really matters for me is to know that you have invested so much in me. I find it joyous to protect myself, my family, and my community, and my Jamaica. For I think my Jamaican government is doing the best to see that I am comfortable. We need to help ourselves, man.
I appreciate that, but tell me now in specific terms. You told your wife to sleep downstairs and you sleep upstairs. What are some of the things you ate out of? Disposable cups or
No.
plates?
Total separation.
Total.
It's harsh, but you have to bear it.
Okay, and the utensils and use of utensils and that kind of thing.
As a matter of fact,
Yes.
I'm upstairs and she's downstairs. And
Okay.
if I didn't have it, if I was even less fortunate, I would have locked in a one room. I should push the food through the food place and use it. We
Well,
need to understand how serious this thing is.
I like the passion. I like the passion. But that's it's important because
It is.
we have cases, right? I mean, I listened to the report of the clinicians. Clearly, I'm not a doctor. I'm not out there. But it is alleged that just the process of serving meals in the household has led to, or could have led to, the transmission of the virus from one person to the next. Just the process
we
of
don't
preparing the
understand.
meal, carrying it upstairs, serving it
That's
to
right.
the son, the daughter, whomever, and that exchange has created a transfer. And so it's very important.
It's very important. It is.
Right.
It doesn't make sense to say you don't feel sick this minute or feel that minute. Wait out the process. I've been to places, I've seen people who violate that which they were told and see the consequence.
Right.
If they will face a consequence, we will face a consequence also. And I think we're doing good.
Yes.
But we need to help, man.
And then the
help.
final thing is, of course, that persons who are staying at home, observing the rules, maybe, breach one very simple requirement, which is if you're feeling sick,
That's right.
a headache, a fever, whatever, some people
hide it.
ignore those
right.
signs, either because of fear of feeling that they're going to be confirmed as COVID positive or otherwise. And that non-reporting of symptoms leads to transmission from one person to the next. Because when you are symptomatic, that's when
right.
you are most effective in transmitting the virus from one. So a simple little headache, if you're in
That's right.
quarantine at home or stay at home, you need to call and report. So I'm assuming that you have not experienced any of that. You sound like a very energetic and healthy person, so I doubt it.
Yes.
But what's your take on that?
The fact about it is that we need to pay key attention to our body. Early detection saves lives. And if we can have somebody who we can talk to concerning, which I know we can call the helpline, for proving it for myself, and tell them about how you feel, they will give you advice. And I know you didn't ask me this question. The helpline that you have, it works. It works properly. You have some staff, I might tell about, I have an experience, this for me not very good. I have an experience with one of your staff, and I will tell if I met that young man now, I will shake his hand.
Okay.
The truth is, Jamaica need to know that the ministry and the government is trying their best. I've seen it because I've traveled, and I'm telling you, this is first class, high class treatment we're getting. And we need to put away our foolishness and be appreciated. And if we stop put bad mouth on things, I am very skeptical. I'm not a politician, and I'm not a preacher, which I am. But the truth and the fact is time, truth be told, man, you people are doing a wonderful, wonderful job.
Well, help me to tell everybody that COVID a keep. COVID a keep, and they must be careful.
That's right.
Thank
They
you.
need to understand. And they need simple people like myself to tell them that, listen, man, build up your folly ground, man. You're getting help, and it is first-class treatment.
Okay, thank you very much. We appreciate
Thank you.
the participation, the contribution, and the very simple, forceful message that we hope
you, sir.
others will listen and follow through on. Appreciate the effort, and thanks again.
I will always do it. Anytime, call on me anytime. I'll give my advice.
Okay, all the best to you.
Thank you, sir.
All right, thanks a lot for that. I think this session of having two returnees was very important because we need to get that message out. I mean, sometimes we say it every day, and I don't think persons sometimes after a while they become numb to the message that comes directly from the ministry, from the technocrats, from the officials. It's important for that message to be signaled and direct from all different quarters. So having persons who have come in and experienced the issues and getting their feedback. We know there have been issues. The interviews, the two interviews are not in any way, shape, or form. I've never met these persons. I'm not sure how the team went out and got them, but the fact that they have been so overwhelmingly positive, I hope doesn't give an impression that we have a perfect system, because we don't, but there is a deliberate and significant effort by the public health team working with other agencies of the state, customs, the constabulary, the JDF, and others, to give the best possible service to the Jamaican people, to non-Jamaicans who are coming in to our ports through our ports of entry. And that, I will say without fear of contradiction. The reality, however, is that we have to shift gears, because we are at a point where the numbers just doesn't allow the status quo to remain. And in adjusting that status quo, in changing the system to accommodate more persons, which means more movement, which means relaxation of restrictions, it means some of that or more of that burden has to be shifted to those who are being given that opportunity to move more freely, which is why we say to them, you have to inform yourselves and take the necessary action to protect yourselves. So we do have issues, we do have challenges. Over the last couple of days, those challenges have increased with more persons coming in, but we're working to regularize the process, or anyone else via social media. Stephen, over to you.
Thank you very much, Minister. Just reminding our colleagues on Zoom to use the raise hand feature. We're going to go to Janet Silvera.
Thank you very much. Good evening, all. I have a number of questions. First one is, we're moving away from testing everyone. Not testing everyone, but testing, right, from testing everyone. The CMO has said, does that mean that persons that are coming from areas that are not high risk, such as Atlanta, California, those other areas, are those the people who should expect to come to Jamaica and not be tested? 1, 2. Is it that Jamaicans coming on vacation go to visitjamaica.com, or do they go to Jam COVID? That's Jamaicans who are visiting. Will Jamaicans have to pay to get tested? And finally, if I am placed in quarantine for 14 days and I do not get my result after the 14 days, do I come out on my own, having taken the test, not getting the result 14 days later?
I'll ask the CMO to start, and I'll follow up if necessary.
Okay. All right. Thank you for your questions. So we have listed the locations that are right now we have designated as high risk, but I'm sure you understand that there will be changes because things are constantly changing, and we may have to update on those locations as time goes by. The other thing is that persons with a Jamaican passport would apply on Jam COVID, and all other persons would apply on Visit Jamaica. Jamaicans do not pay for testing. And if you, right now, we are looking at the situation about the wait for the test results. As you can imagine, as the numbers have increased, there has been an increased waiting time for the results. But what we have discussed with the health departments is that we will call persons and make an assessment. So, for example, somebody who, for example, a business traveler who is coming in at and is expecting a result in 48 hours, who will want to carry out their business, we will call them at the end of the 48 hours if their result is not available and do an assessment to find out if they're having any symptoms, to assess their risk again, and to see if there are any ways that we can see they can carry out their business safely. We will also be doing that for persons 14 days quarantine, who at the end of the quarantine period, if you're designated as high risk and you've had a test, then at the end of the 14 day, we would be requiring you to do another test simply because you are in a high risk group. And so we are looking to, by decreasing the numbers of tests that we're doing, we're hoping to get back to our 48-hour turnaround time shortly. But we are looking at calling persons, checking if they have symptoms after 14 days, and assessing their risk to determine if they are free to go.
Okay, thank you for that. I hope that answered your various questions, Janet. Stephen?
All right. Thank you very much, CMO Minister. We also have questions from persons on social media. There's one question they're asking for a Jamaican resident who wishes to travel to Florida and return in 6 days. What is the return protocol?
Well, in the first place, we would advise persons not to travel at this time, and especially if you're going to a location where you see the numbers are rising and there are many hospitalizations, and every day it changes. You have to keep monitoring what is happening on the air. So my first advice to persons that if you do not absolutely need to travel, it is better to stay home. If you are a Jamaican and you have traveled, then you follow the same protocol in coming back home. You would need to make an application on the Jam COVID site. You will not need to have a pre-test done, but you will be assessed when you come in to the country, a health assessment will be done and a determination will be done if you need to have a test. Once you come back home, you will be given a quarantine order. You will be required to stay at home for 14 days. Persons have to understand that the risk of exposure is real and that you need to be monitored for those 14 days on your return.
In other words, the threat of a Jamaican versus a non-Jamaican returning from a high-risk destination, such as Florida in this instance, for now anyway, are no different. It doesn't matter whether you went up for 3 days, 5 days, 2 weeks, or you were there coming down. There's no difference. Persons should expect to go through the process, the risk assessment, and all the protocols or features of the protocol that accompany that. I have had persons calling me, asking me they want to go up for 3 days or for 5 days, almost as if going up for 3 days means a minimized risk and therefore a different treatment. I want to disabuse persons of thinking that way, and also to say neither I or anyone else can help them with any more favorable treatment, because it's really about the risk and doing what is right in the protection of the population.
Thank you very much. I just want to ask one more from social media before we go back to the media. This person, I think, is coming to Jamaica, and they're saying, please clarify if a COVID test needs to be PCR or if we can bring the rapid results, which will enable us to get tested closer to departure.
PCR.
There. All right, thank you.
PCR, just to be clear. PCR.
All right, we're going to go to our media colleagues now, Jamaica Social.
I have about 3 or 4 COVID-19 cases. So obviously that is obviously, I'd say, the reason why so many Jamaicans want to get out of there. Can Jamaica, recent studies have shown, Dr. Fauci from the US system says, a recent study has shown that the virus has mutated in the US and has become more infectious. Is the CMO or the epidemiologists, are they following this? And can you right now separate the different strains of the virus? Can you tell from your testing, Jamaica, right now, whether the virus, this person, the strain that they have is the Chinese strain or the European strain? And that's one question. The other question is, of the persons who are now ill, how many of them are over the age of 65? And just following up to something that the minister said, you said that, people, or that the CMO said about people now will be given thermometers. I'm wondering, will people be given thermometers? Because you're now going to be asking them to, as you say, as you go along further in the process of testing their own temperatures. Will you be providing that? I'm curious. And finally, to the minister, this is essentially a transfer of responsibility, primarily from the government to the Jamaican, to each Jamaican regarding fighting and living with COVID-19. Is there any way you see yourself requesting or seeking help from the corporate sector to help facilitate you so that you will still have a tighter grip on the system? Because this transfer to having people kind of do things and hope that they do things, you're going to see many possible cases falling through those cracks. Your thoughts on that, Minister? Thanks.
So while the CMO gets her numbers around the 65 years and over, I'm not sure if she has it on file here, but the the truth is that the COVID response has been very collaborative up to now. Clearly, it's an all-of-government approach. The Honorable Prime Minister has chaired a cabinet subcommittee and, of course, cabinet, where decisions are ventilated first with ideas being put on the table and then final decisions made. Public health clearly is a dominant player in that, given that it is a health challenge. So we do a lot of the initial work from a public health perspective, and make recommendations as to what we think are the approaches to take at a particular point in time, largely based on a risk assessment of the situation, and that involves a number of variables. When that decision is taken, however, it's a government decision, and we collectively work to advance through the protocols, but also through enforcement, but critically too, through collaboration, which is the point that you were raising. So the private sector organization, for example, the umbrella body PSOJ, Chamber of Commerce, Jamaica Manufacturers Group, we collaborate with them. I have an advisory body that involves a number of private sector interests who I meet with periodically and help bounce ideas off them, get ideas from them to sort of influence the overall implementation and the policy position that will seek to hopefully educate and inform Jamaicans and get them involved. The reality is that Jamaicans sometimes are not very easy to be swayed in a particular position. And culturally, we do have a tendency to do our own thing, not always respect particularly some of the basic rules of engagement or laws, whether it is throwing waste through a car window while you're driving or otherwise. And so it is difficult, it is a challenge to improve or to push health-seeking behavior or behavioral change to avoid the spread of COVID and the threat of COVID. And so it continues to be a challenge and continues to require collaboration. So one of the things that we've done is develop a communication strategy, reaching out to critical stakeholder groups, the churches, in the school environment, persons of influence in the community. And the reason we are hiring these community health aides who are now in training, many of them are in training, to direct them into communities, is to try to drive that collaboration more and to get Jamaicans to understand the importance of what is happening. This phase of the COVID response requires all of us, everyone, to play their part more so than ever in minimizing the risk of COVID. We cannot sleep outside your window or your gate when we send you home and ask you to stay indoors, stay away from your loved ones for the period of time. We cannot be always checking up on you. We just don't have the capacity to. And so we can't enforce everybody wearing masks. We can certainly do with some, but it's difficult to do it with all. And so it really requires a conviction on the part of individuals to play their part where everyone counts. That's what we say. And that is an ongoing effort. And to the extent that we have support, we're going to embrace that support. CMO, you want to just respond quickly to the other?
Yes, thank you, Minister, and thank you for your question. With regards to mutations of the virus that would make it spread faster and be able to affect more people, I mean, this is still new information, and from my own exploration of the matter, it is not really through information that is coming through any studies in human beings. It is really what you call an in vitro observation, which is pretty much in a test tube observation that the virus mutates. And there's a possibility that this mutation could cause an increase in viral load and make it be able to spread faster and affect more people. But I don't think that there has really been any kind of finding of these new mutations in persons, and that translates to being an explanation as to why it is that we are seeing the spread there in the US. So this is still new information, and I would really give it more time to see what happens out of those studies that are happening in the laboratory and how they inform what is happening in actual transmission of the disease. In terms of our elderly persons, we have seen up to July the 1st, 62 persons over the age of 60 that we have confirmed as positive.
Thank you very much, CMO and Minister. Here's a question here that we're going to ask PS to respond to regarding the current state of the mental health of the staff across the island and staff morale at this time.
Thank you very much for that question, Stephen. The overall state of the ministry in terms of all its parts, both in terms of the regional health authorities, the central ministry, National Health Fund, is that persons do have a sense of fatigue. There is a sense of fatigue coming across all sectors of the cohorts that work in the Ministry of Health and Wellness. Even not the stable right here, we ourselves are beginning to see the signs of some level of mental fatigue and physical fatigue. And I am giving instructions left, right, and center, instructing persons to go on leave at this time, because there's never ever a good time to do that. However, what I want to acknowledge is the sheer dedication of the team, and that was on full display over the past 4 or 5 weeks or so at the airports, when staff members, despite their fatigue, despite the sheer level of effort that they had to put into making sure that the protocols that we had at the airport were in place, just the commitment of everyone to ensure that we did the best job that we could with the limited resources that we had. And that is, without a doubt, a sign of a clear commitment to all of the efforts to keep the Jamaican population safe. And that's what we are here about. I want to acknowledge and to share with the CMO and the Minister, I'm sure, our appreciation to the field level, especially at the regional health authorities, and the fact that they have pulled it off. We sit and we take some of the accolades, but in truth and in fact, the operational staff have made it happen. The ideas, the innovations, all of what we have put in place are executed with a level of alacrity that makes it impressive what we are doing, and we want to salute them indeed and to acknowledge them for this effort. But we are fatigued, and we continue to be fatigued, but we continue in the battle.
Just to say that our mental state is sufficiently sound to continue working. Not to give the impression that we are that broken, that we are motivated. And I must tell you that it's a good team. Both the PS and the CMO have provided excellent leadership, and certainly the other unit heads and the many thousands or hundreds of frontline workers out there. I think Jamaica can feel proud that we have really risen to the occasion. And what came out very strongly at me was what the Consul General said about Dade County: 2.7 million, 40,000 positives, over 1,200 deaths. Jamaica, 700 positives, 2.7 million, and only 10 deaths, as bad as a death would represent. But it does indicate the sort of response, or at least gives an indication of the quality of the response, which we're happy for. Mental health is a big issue in Jamaica. It's very stigmatized, and there is a particular perception about what is mental illness, and it's something that as a Ministry of Health we've been trying to shift. It's going to be a process, but you're actually right, or the person who raised the question. I was just jabbing the PS a bit by commenting on our own state of mental health. The fact is that a large percentage of Jamaicans would be impacted by the mental anguish and stress related to COVID-19, the isolation, the quarantining. You're not used to it, so having been required to do it, it does weigh heavily on your minds. And for us who are helping to lead that charge and who are responsible for really developing those protocols, it does weigh heavily on us that persons have to be restricted in the way that they are unaccustomed and in the way that may hamper their economic activities and social interaction and so on. It's very unusual, which is why we say it's a new norm. It will take time for persons to get used to it, but hopefully we have coping mechanisms which we promote and we should seek out to overcome the challenge that is at hand.
Thank you very much, PS, and thank you very much, Minister. We're going to go back to Janet Silveira, who had a follow-up question.
Thank you very much. Okay. Thank you very much. The question is to the CMO. I'm not satisfied with the answer that I was given as to how you and your team plan to determine no testing of persons arriving in the country. How does one qualify? Is it that, and what's going to happen to visitors from other states? Are they going to be tested at the airport or they won't be tested?
Right. So just to go back to the protocol that we shared at the beginning. So persons, Jamaicans that are coming in to the country, we will have an assessment. There will be a risk assessment that is done at the airport. And based on that assessment, they will be categorized as high risk. So persons who are not categorized as high risk will not be tested. So the risk criteria now involves the location that you're coming from, but it also includes some health criteria in terms of age, comorbid illnesses, in terms of your exposure, what kind of situation that you're coming from, if you would have had contact with anybody, and of course, if you have any symptoms. So if you don't have any health risk criteria and you are not coming from a place that we have considered to be at risk at this time, then you'd be given a quarantine order. Now, if during the period of quarantine you develop symptoms, then you would be tested. So remember now that there are persons who will come in and they would have done a test and may be negative at entrance if they're deemed at high risk. But later on, they may develop a symptom. So the important thing is to try to catch when that person develops symptoms and to test that person. For the visitors that are coming into the country, so the visitors that are coming from the high-risk locations, that is a criteria that will say that they will be tested. For those that are coming, that may not be coming from a high-risk location, but still have the other high-risk criteria in terms of the health criteria, the possibility of contact with somebody, the high-risk exposures, then those persons would be tested. Most importantly, though, it is for us to remember that the 14-day, the quarantine period, the stay-in zone period, the adherence to the infection prevention and control measures, those are of most importance in detecting symptoms early. The testing when persons become symptomatic is really where we will pick up the highest number of persons that are positive so that we can contain that infection to prevent spread.
Thank you, CMO. Final question. Do you have a percentage then in mind of the visitors, not Jamaicans now, but tourists coming into Jamaica, who you feel you'd want to test? Do you have a percentage?
It is really difficult to give a percentage of persons that would be tested. We are trying to get that kind of feedback to look at the demographics of persons that are coming in, to explore age for one, that would give us an idea, and also in terms of the flights that are coming in from the high risk areas. So we don't have that number right now. There has been a drastic change from what happened in June to what is going to happen in July. So we have to now look at that information to be able to give any kind of estimate as to how much. And this is something that almost changes daily in terms of our ability or capacity to cope with the numbers. And this is why I keep emphasizing, Janet, that that 14-day period of that, or that period of quarantine in the zone, in the hotel property, and the checking to see if persons have symptoms, the reporting to the authorities. If you're staying in a villa, if you're staying in a hotel and you develop any symptoms, to report to the persons there. Every facility is supposed to have somebody that is designated for you to report your symptoms to. If you're at home, if you're a Jamaican that has come home, or if you are somebody that are visiting friends and relatives here and you're given a 14-day quarantine order, that we know we have the capacity to test, and we must have the capacity to test for those persons who develop symptoms. There's no if or but there. Those persons must be tested. Anybody that develops symptoms, and we want to have that capacity at all times. The ability to test everybody who is just coming in, not having any symptoms. From day to day, we make that decision, based on the numbers that are coming in. And, the 30th of June, we were testing everybody that was coming in. Today, it may be that based on the numbers, we're not able to test everybody. But everybody is going to get a quarantine order, whether it is stay at home or stay in zone. And everybody is going to get the public education and the health information to increase their awareness, for them to know that if I should develop symptoms, I must report it. And once you report it, we are going to test and we are going to contain that infection. That is where the battle has to be. It's a tremendous utilization of resources that we do have to remember that we're a small country. We just don't have the ability to continue with the numbers that are coming in. So we have to really look, our surveillance measures have to kick in, and they have to be sufficient if it is that we are going to protect our country.
Thank you very much, CMO. Our other media colleague had two questions, but I think he got bumped off, so he didn't hear your response. CMO, regarding if returnees will be required to acquire thermometers, and if our testing can identify the viral strains.
Okay, well, I kind of intimidated on terms of the viral strains to say that, what has been mentioned in that forum is really is not that they have established in humans a change, a mutation that they've been testing for. What I just want to reiterate, we've said it in past press conferences, that Jamaica's National Influenza Center is a part of a global network that samples from all this, the samples from the COVID testing and from the influenza testing from before are sent periodically for genetic sequencing to be done, just for that purpose, to see globally if there are any changes in the strains that are occurring. So Jamaica is a part of that network, and we do submit samples for that testing. In terms of the thermometers, no, a lot of persons that would have come in already would have known that we have distributed thousands of thermometers. It's a part of your quarantine pack that you get. Now, our ability to continue, again, is going to be based on numbers. But up to now, we have been making an effort. Persons that come in, they get a pack that includes a few masks, a thermometer, a symptom log sheet for them to log their symptoms on. And so we have been doing that up to now.
Thank you very much, CMO. We're just going to take two final questions and I'll ask Minister to conclude. Somebody's asking, what is the age requirement for testing at the airport, as I'll be traveling with my children ages 16, 12, and 10, and they're arriving on the 8th. And is there a safe protocol? Are there safe protocols in place for when I go to the health center to be tested?
age protocol for testing at the airport? 12
Right.
yeah,
No.
go ahead.
Okay, so our protocol really does not specify an age because based on varying circumstances, we may have to test persons that are younger than 12 years old, depending on the risk of the family that they're coming in with. But up to now, it has been discretionary and we have not been testing persons that are younger than 12. But it's not to say that we may not, based on the assessment of the family and of the person that is involved. What was the
The
second
other
one?
question is, at the health center, when I go there, what's the protocols in place at the health
So
center?
yes, I can assure persons that our protocols are safe wherever it is that you go to get the test done. We have spent a lot of time training persons, updating persons, and we do our best. It is an uncomfortable procedure. I myself have had it done twice, and with other persons at this table have had it done, and I know that it's an uncomfortable procedure, but I must say that the teams that are out there are very, very supportive in trying to get you through the procedure, and it's a quick procedure. But I can assure you that it is safe. It's a safe procedure. For every procedure, there's always a possibility of some discomfort, and may have some kind of complications can occur. But we do our best to minimize anything like that from happening.
All right. Thank you very much, CMO. I'm going to turn over to our minister just to give his closing remarks. Thank you very much to our colleagues.
Right. Thank you very much, Stephen, and thanks to the Chief Medical Officer, as usual, and the Permanent Secretary, as usual, for being here and for giving critical support and the leadership also. Ladies and gentlemen, the key messaging here for today's COVID conversation is that we are still in a COVID-19 alert state. We still consider COVID-19 a public health threat that potentially can cause damage to individuals, to communities, and by extension to our country. Having said that, we have made decisions in our new protocols that are allowing greater levels of movement, largely because we have to establish this new norm, which will see and should see persons being allowed to move in country and otherwise within the country. But it's so important for us to recognize that these new protocols come with critical, the need for an understanding of the situation and the process, and the need to take the necessary precautions. To observe the protocols that have been established around testing, we have had to adjust. It has been necessary because the numbers coming in requires it. It's not to say we are not testing or we won't test. It's a part of the overall risk assessment, and there are several other parts to that overall screening or risk assessment, and testing is only one of those critical techniques. Beyond that, Jamaicans who go home and are asked to stay home, to go to their health centers for the testing, to observe the protocols of stay at home or home quarantine, not to interact with family members, managing themselves, calling in if they have symptoms to report those symptoms. Absolutely critical, because the intention is to control the potential spread. And if you are at risks, we want you to manage that risk, because it is in managing that risk we will minimize spread. And the testing protocols that we focused on today is an attempt at generating better understanding of the process. I want to thank the CG who came in from Miami, Oliver Mayer, the two callers who came in who recently returned to the country and had nothing but praises for the process. We appreciate them coming on. We recognize that there are challenges and will continue to be challenges, particularly now with increased numbers. We ask Jamaicans to be patient, to work with us, because this is all in the interest of their health and wellness. Thanks to the medical team out in the field who continue to give significant service, and we will continue the conversation over time in order to complete the process. Oh, I see. Big up the 2020 incoming doctors. Okay, right. So we have had some new members of the medical fraternity. In fact, actually, 2 persons called me earlier to recognize their new status and to say thanks for, whatever advice that was given. And I want to just take the opportunity to congratulate and welcome the new team of doctors that have recently been qualified. I'm sure they're having a really enjoyable day today. There's a lot of work to be done, and we certainly welcome them. And of course, the reputation that is already established by others before them requires much of them, but we know that they're up to the task. So congrats to all who have come in. I want to also remind persons to call to make appointment for testing if they have symptoms, and of course follow up with the appropriate contacts. And these are non-travelers, non-nationals. Non-travelers. Oh. All right. You see, I'm getting a lot of instructions prior to departing this conversation. The conversation continues. No, the CMO is saying to me that while we're focusing on persons coming in who have symptoms to call, persons who reside here who may have been exposed in one way or the other, they should also call, which is very correct, and report any symptoms that they have so we can quickly assess and determine if they're so affected. Thank you very much. Have a good evening, and we will continue the conversation. Thank you.